I mean, just to answer the question of the superhero, to kind of bring back to that, I wrote this quote down yesterday. If you have seen further, it is by standing on the shoulders of a giant. And I thought that was really powerful because 237 of us, are those giants. And we have the capability with all the minds in this room to make all of these things happen. And it's us giants allowing anyone else in this profession that we need to uplift, to stand on our shoulders, to be able to see the distance, to see the future, to see what we all need to be. It's a scary world to think of, okay, when Dimi and Kostas and Craig are not around anymore, what is the next generation going to do? What are we going to do to keep this going and keep the power of PT fulfilling and fulfilling and fulfilling and growing? And I think it starts here. It starts today. It starts now. It starts every day that you go into the office. So take hold of the giants that we have. And if we have giants standing on giants, just imagine how powerful we'll be.
I just want to say one thing. So I went to the Graham sessions with Dimi and Kostas, and that was the first time I've been to a conference in like 100 years. And, because you're so stuck in your practice. And I didn't, well, that was an excuse. I just didn't go to conferences. But it was interesting to go there and hear everyone's pain points now. And, so I get more awareness of what's going on. And I started thinking, like, we got to get at the schools. And I really would love to go to some of the local schools in my area, talking to them about options out of school. And in this case, electrodiagnostics. And if more students came out, me and my buddy were talking about this as a PT, like we should have fellowships. When a PT is in school for the first 2 years, the next 2 years, there should be residencies or fellowships if they want to go into acute care or outpatient, like medicine. Like after 2 years, you pick where your track is. Because what good is it if you have a generalist that graduates as a DPT and they want to work in acute care? That's not going to help us in outpatient. So it started getting me thinking, if I can reach the schools and these students coming out and enlighten them on the current landscape and autonomy and decision-making and electrodiagnostics, we can get more funneled into electrodiagnostics and advancing the profession and then also working with practices to continue to put diagnostics in is exciting.
There is, what you say is actually very powerful, because just imagine the effect, the impact it's going to have in the profession if you had physical therapists who were only primary care providers, and that's it, like evaluators of problems, where they then funnel their patients to the various specialists, to the electrodiagnostic specialist, the orthopedic specialist, the acute care, whatever specialist. That would, on the one hand, it would, I think it would create a much greater drive of patients into physical therapy practices. It may have a bit of an issue because we would need a lot more PTs, but it would definitely drive a lot more patients into this.
And the other thing too, when we were at the Graham sessions, this one guy was a PT at the White House, and he was the only PT there. And he was explaining how his role as a PT was to evaluate, diagnose and put a treatment plan together. And he had techs and extenders taking care of the patient. He goes, I'm a PT. I don't need to count reps and sets and this and that, which I really agree with. I think we go to school and our sacred, bag of tricks is the evaluation, the diagnosis, the assessment. And that's what's important to us. The fact that Medicare cut that code this year is very disappointing. So us as PTs need to really embrace that and figure out how are we going to put ourselves in a different playing field than just being treaters. And diagnostics is a huge role in that.
Well, I think a key for me today, and I talk about this basically about every day in my clinic, is when we look at where we are, probably one of the most important providers that a patient is ever going to see is a physical therapist. Why is that because we are going to get them functionally back. I think we can all think of patients and people that are in nursing homes or died because they didn't get the care, they didn't get that rehabilitation that made a difference. And, I think it's crazy. And I'll give you, for instance, my sister-in-law here has had some heart problems, and she just found out this month that for Jardiance, her cost for 1 month is $1,799. And think about how much a plan of care costs right now. Granted, I do agree that we need to be paid more for it, but think if we could do, because the Army, the military has had this already flipped up since the 70s. I was jealous of some of those guys because every patient went through a physical therapist before they saw an orthopedist. And over 80% of them never had to see the orthopedist because the physical therapist. That's where we should be. We should be the ones doing the triage, doing the decision making. We have the skills and the ability to do this, and this is where we should move forward. And the thing is that we are working hard to try and do that, but we've got a lot of work ahead of us to actually achieve that reality. But, we're going to have some obstacles and frustrations in this process, and you younger guys are going to be here long after. You'll probably still be fighting it. But I think as long as we can do that as a group, we'll get there. It's just the problem is we are the most forward-thinking people in our profession. We are the most forward-thinking people. Those that work for others, I hate to say it, but they're not there. They're not there because they're just working for someone else and doing it. But we have to continue to be those leaders in that. So you guys, I just put it out to you that, long after that, you're going to keep fighting for this because you are going to have a fight for quite a while, but it's achievable if everyone comes together and does it.